My title of the representation is Complication Following Facial Plastic Injection Therapy. Over the past decades, soft tissue filler injection are the second most commonly cosmetic procedure performed by plastic surgeons following botulinum toxin injection. And here are some common facial tissue fillers which can be classified in three types: and the autogenous tissue, biodegradable material, and non-biodegradable material. And the facial tissue fillers can also be classified as the two types: an injection type and the implantable type. And the five purposes of filling therapy are shown in this slide. And the first is facial rejuvenation. And the second, making organ shape more beautiful and correcting organ position and filling the depression. And the last is improving skin appearance. And the first purpose is to achieve facial rejuvenation or improve wrinkle. As is shown in the picture, there are several wrinkles on this woman's face. Among these wrinkles, and the tear, trough, nasal labial sulcus, and oral comedial wrinkles are most common. And so we use soft tissue filler injection on these sites and always achieve good results. And another purpose includes shaping. And as shown in the left picture, there are 11 sites need to be shaped as we summarized. And for example, chin and nose. And soft tissue filler injection may have many advantages. However, filler can also cause complications like any other medical procedure. And if neglected, and it can cause both early and late unwanted side effects with varying degrees of severity. And the causes of complications are listed here. And the first is the material-induced immune response. And the second, and different plastic surgeons have different injection techniques and familiarity with anatomy. And the third, the result also associated with patient physique. And the last is the processing methods and the speed also matter. And here, association between filler types and complication. And the complication of short-acting products were significantly less than that of long-acting products. And the natural products were much less than that of synthetic products. And the regular products were significantly less than those of fake products. And adverse cutaneous reaction from fillers are classified according to the duration of one site. Acute or early one-side reaction occur within days of the procedure, and the chronic or late one-side occurs weeks to years after the procedure. Acute reaction include erythema, blooding, and tenderness, swelling, bruising, and so on. And the chronic reaction include malar edema and persistent discoloration, delayed hypersensitivity reactions, infections, and filler migration, and foreign body, and granulomas. And what draw more of our attention are 5 severe complications of injection filling, which are soft tissue necrosis and vascular obstruction, blindness, and hypersensitivity reaction, and hemiplegia. Among these, soft tissue necrosis is the most common complication that reported. Fortunately, incidence of these severe complications was only 0.001%. And this article discussed correlation between injection site and complications. And we can see nasal complications are the most common. And in this article, it is reported that 32 cases of blindness caused by injection, and 15 cases followed fat injection, and 17 cases followed other injection. To avoid these complications, here are some precautions for injection. And use local vasoconstrictor, and the second is pump back before injection, and use more needle and syringe, And fourth is use low pressure injection, not high pressure injection. And next is the injection volume on each point should not be too much. And the last is the original surgical injury site should not be injected. If complications happen and we need stop the injection immediately and then press the injection site locally and apply cold compress. And we can also apply hyaluronidase, and if necessary, observe closely and use the anticoagulants. Okay, next I will introduce several common complications. And the first is pain. And the incidence rate is 1%. Prevention methods include and the nerve block and seizure, and the surface and seizure, and ice compress, and oral analgesics. And the second is the vascular injury and ecchymosis. And the prevention and the treatment methods include familiarity with artery and ice compress and a moderate press. And the third is localized allergic reaction. Prevention and treatment methods and they include avoiding irritation and ice compress, the light diet, and the oral anti-allergic drugs, and ketotifen, and the last is hormonal therapy. Next is swelling, and the prevention and treatment methods and include ensuring the currency of injection site and a small amount and multiple injection, massaging and hot compressing, and the last is applying and hyaluronidase. The fifth is lumps and nodules. And prevention treatment methods include point injection in superficial ear, avoiding column injection, massaging and hot compressing, coated controlled release, and applying hyaluronidase and hormonal therapy. And the sixth is theater movement, and its incidence varies with the location. And prevention treatment methods include be familiar with anatomy, and the injection level should not be too shallow, and do not massage or compress after shipping. And the seventh is erythema. Prevention and treatment method is aseptic operation and a simple traumatic treatment. Next is scar, which is caused by hematoma, the foreign body reaction, and the tissue injury. The prevention and treatment methods include preventing hematoma formation, taking proper measures to cure in time, and we can use silica gel film and comprehensive treatment of keloid. The ninth is skin necrosis, which is caused by large air superficial injection and obstruction of subdermal vascular network. Prevention and treatment methods include avoiding large air superficial injection and natural glycerin injection and hyperbaric oxygen. The 10th is foreign body granuloma, and prevention and treatment methods include avoiding skin irritation and anti-allergic drugs and the hormone, antimicrobial therapy, and immunosuppressant and surgical management. And the next is delayed edema in recurrent. Prevention and treatment methods include using high purity products and hyaluronidase and hormone and antimicrobial therapy. And the 12th is fatal toothpick, which is caused by injection into interstitial and loose tissue, excessive massage and hard compress. And macular weight and cross-linking degree of the productive cells. The prevention treatment methods include choosing the right products, injection to the right organizational level, and moderate massage. The last is doctor's aesthetic standard. Poor aesthetic will have a bad impact on the patient appearance. Next part is the 3 severe complications. And the first is the full thickness tissue necrosis. And the second is blindness. And the last one is hemiplegia. The first is full thickness tissue necrosis. The main causes of this complication and it includes direct access or injury to blood vessel leading to embolism. And squeezing blood vessels leads to ischemia and vasospasm. And this picture is the anatomy of a nasal artery, and anatomic familiarity is an important basis for avoiding this complication. The second is blindness caused by artery embolism. And this picture shows arterial circulation between nose and the orbit, and shows how an embolus reaches the artery and causes blindness. And we can see in this slide, if the blindness happens, and most patients cannot recover their vision. In this slide, and the steps for injection fitting operation was summarized by our team. And the third is hemiplegia caused by cerebral arterial embolism. And this is a case reported of cerebral artery embolism caused by fat transplantation. Prevention and treatment methods of these severe complications are as follows. And prevention methods include be familiar with the course of arteries, and pay attention to the dangerous point on the face, and use and plug artery trunk and retain before injection, then restore injection. In 2012, a total of 441 patients underwent injection removal surgery in our department. So the complications cannot be ignored. And thank you everyone.
Thank you very much for your presentation. I have a question. You told us the right way that when you have a vessel embolization, there is pain, so stop the injection. But what do you think about when you use hyaluronic acid filler with lidocaine? I mean, in this case, patient could not feel pain due to the lidocaine. So do you prefer filler with lidocaine or without lidocaine in order to identify some troubles also thanks to what the patient is feeling?
Okay. We don't always use the lidocaine to all patients. Like in nose or chin, we always don't use the lidocaine. But if the nasolabial injection, we use the lidocaine. And the patient, okay, thank you. Any questions on now? Okay, let's move forward.
Is that okay? I have a question.
Okay, Professor.
Yeah.
Thank you.
As we know, some practitioners in some private hospital, they may use some growth factors such as recombinant basic fibroblast growth factor to inject to the subcutaneous tissue. And a very terrible complication is that, for example, in the jaw, that's a very big and continuously growing jaw. I think maybe there's a granuloma under the skin. So how have you ever seen such a case with this high dose growth factor injection? And how did you treat this kind of complications?
Thank you for your questions. And for these patients, we also often do the operation and first remove their fillers, and then the fillers all the chin, like the chin, always the appearance is not very well and has some, and it has some it's very long, and we can use hormonal therapy. Yeah, and to make the chin the diffuse of the chin to shortage. Okay.
So in such case, this is not dermal filler, just you know, there's a high dose injection of some growth factors. So that causes the hyperproliferation of the soft tissue. And this soft tissue continuously growing bigger and bigger.
Yeah. We just like do the treat ecchymosis, and we use a hormone therapy and
injection
and injection to the
steroid
side, and
and also you use surgical methods to remove the enlarged soft tissue, right?
Yes, that's right.
What hormones do you use? What hormones? I mean, just steroid injections or Canalog, triamcinolone, or other things?
Nebulones, yes.
Oh, okay.
Okay, we